I'm Dr. Nicholas Vetrano, emergency department physician here at Tanner Health System. Patients are hesitant to come in for a multitude of reasons. One is that they're afraid of contracting COVID. Two, they're also hearing that the hospitals are full or that there are people waiting in the hallways or in the waiting room. But we want patients to understand that if they are sick, they're going to get the care that they need. They're going to get the room. They're not going to be turned away. Signs of heart attack can be multiple. We always think about the chest pain. However, there are other symptoms such as breathlessness or shortness of breath. You can have sweating. You can also have nausea and vomiting. You may also experience things like pain radiating into your neck or into your left arm or shoulder. It's very important to act quickly with signs of a heart attack because time is muscle. The longer we wait, the more damage actually occurs to the heart muscle. If you wait too long, the damage to the heart muscle can be irreversible. Patients feel like, and families feel like, that once COVID hit, we suddenly started implementing these processes. We want to let patients know that these processes were actually in place before COVID. We have an infection prevention team here that had certain protocols in place. Now those things did change when COVID hit. We required patients to wear masks and their visitors to wear masks, and also patients could only have one visitor. However, even now that those mandates are going away, we still request patients to wear masks. Also, every room is cleaned after every patient encounter. Some patients may want to drive themselves to the hospital in order to potentially avoid any costs related to an ambulance ride. However, that is really not in the patient's best interest. If they are having a heart attack, then they need appropriate monitoring. In addition, if something should happen while driving, you could potentially harm yourself or others. Tanner Health System serves a large portion of West Georgia and East Alabama. Some patients may be far away from the hospital in order to receive their care. Getting immediate care via the paramedics is imperative. They can start medications prior to arriving in the emergency department, but they can also send us the patient's EKG if they're having a heart attack, and so we can alert the appropriate people prior to their arrival. It's important to have this teamwork in place to deliver appropriate care, the best care possible, and timely care to the patient. We have a very close relationship between our emergency department staff and the paramedic companies. Several of us actually are the medical directors for the ambulance companies. We have a very close relationship with them so that we can deliver the best care possible to our patients. I think that our relationship does save time, but I think it also makes the paramedics more confident in their ability to treat these patients pre-hospital. My one message would be, don't delay. Seek the care that you need immediately. We are here to serve you.